Hey there, my name is Dr. Brad Deacon. I'm coming to you from Burlington Spinal Decompression. So we're going to do a quick 2-minute video explaining how to help rebuild discs. No matter what you've read, it's possible to rebuild intervertebral discs, and we're going to explain to you how it works. So the first thing that you have to understand is discs are what are called avascular. There's no blood vessels that feed them. The only way they stay thick and healthy is by the proper movement of the spine. The proper movement of the spine pumps water into the disc and keeps them healthy and keeps the vertebra off the nerves. Of course, if the disc gets thinner, the vertebra get closer and then it starts clamping down on the nerve, causing not only organ system and damage, but obviously immense pain. So that's one of the things you gotta understand. So to keep those discs healthy, the vertebrae have to move properly. Now, everybody seems to think all you have to do is yoga, Pilates, walking, running. That's all wonderful. But one thing to keep in mind, if you have improper alignment in your car, you don't go for a trek across country. You don't go on a cross-country road trip. Because if you exercise an improperly functioning spine, it's going to degenerate it faster. So before starting any exercise program to try and help your discs, always make sure that you go to a chiropractor to make sure the vertebrae are moving properly, so you're not accelerating damage. You want to get the vertebra moving properly, get them placed properly, and then start doing an exercise regimen. And as far as exercise go, the hands down uncontested winner is by far swimming. That's the one that helps the most. It puts in a lot of movement into your spine, you're out of gravity, and it actually works the cardiovascular and the muscular system as well. So one thing we also want people to understand is don't take health advice from the hot person at your gym. Because they're in great shape, because they're healthy, because they may be a yoga instructor or a Pilates instructor, it doesn't necessarily mean that they know what they're talking about. Always get your advice from a qualified, certified healthcare provider. First, ideally a chiropractor. Physiotherapists are great. You could even go to a physician, but be careful about what they advise you on. Now, another thing that could help with disc problems and pain is spinal decompression. Spinal decompression is by far the unsung hero. It's one of the best things that you can do because it creates what's called a decompressive force or a tractioning force that pulls the vertebra apart gently, and it helps create a vacuum inside the disc to bring water into the disc to keep it healthy. That gets the pressure off nerves, and if it's done properly, it can be very, very long-lasting and a permanent improvement. At Burlington Spinal Decompression, we have specific care protocols that can actually re-engorge the discs and get them back to normal off the sensitive spinal nerves. Now, keep in mind, surgery failure rates are reported by the Mayo Clinic to be between 40 and 75% 5 years after surgery. So you want to do whatever you can do to avoid spinal surgery. Now, one of the things that we want to get across to you is that discs can be rebuilt. They can be rehydrated. Don't believe what orthopedic surgeon journals tell you. Discs can be rehydrated and be rebuilt. But the vertebra above and below have to move properly. The curves in the spine have to be proper, and the vertebra have to be placed properly before the therapy goes. That's what chiropractic care is for. So decompression, spinal decompression works wonderfully if it's combined with other care protocols. Now, we have specific proprietary care protocols that we've been developing over close to 20 years here. We are, without a doubt, the spinal decompression experts in the area. You can pretty much ask anybody. We are the experts. Now, as far as nutrition goes, we want you to get in a couple of great things that will help with your disc issues. First and foremost, we want to make sure you're getting glucosamine and chondroitin in there. That is the tissue that helps build discs the most. We also want you to start increasing collagen intake because discs are made of a lot of collagen. Now, we also want you to bring in omega-3s. Omega-3s are great fatty acids that help reduce inflammation. It's also great for your nervous system. And we want you to take in B-complex vitamins because B-complex will actually supersaturate the discs and help them get healthier. Now, turmeric and curcumin are great anti-inflammatories, but mostly we want you to bring in water. take a lot of water into your spine, because when we put in those decompressive forces, those discs can get healthier. And of course, movement. Movement is super, super important, but you can't just do movement. You have to combine it with those special care protocols we mentioned. Again, my name is Dr. Brad Deacon. Burlington Spinal Decompression is by far the industry experts at this. If you'd like to talk to us, we're offering a reduced fee. Normally it's $197. It's down to only $50. That includes digital x-rays, state-of-the-art nerve scans, a doctor's report, all the information you need to know to see if we can help you. Please check us out, burlingtonspinaldecompression.ca. Thank you.